Bonsoir tout le monde. Mon nom c'est Jody Dallaire. Je suis coprésidente francophone du Conseil des femmes du Nouveau-Brunswick et je suis aussi la représentante de la coalition de l'équité salariale au sein du Conseil.
Hi, I'm Beth Lyons. I'm the Executive Director with the New Brunswick Women's Council.
Ce soir, nous sommes fiers de vous présenter ce forum préélectoral avec les 5 chefs des partis politiques provinciaux. Ce soir, on traitera exclusivement des dossiers qui touchent l'égalité des femmes. Par l'entremise de projet Résonance, un projet axé sur l'engagement public, le Conseil a demandé aux femmes quels étaient les enjeux qui devraient être traités afin d'améliorer la qualité de vie des Néo-Brunswickoises en tant que groupe. Nous avons aussi demandé quels étaient les enjeux qui ont affecté leur propre vie lors des 12 derniers mois. De là, 5 champs d'intervention prioritaires ont pris forme en réponse à ces questions. Ce forum préélectoral s'inspire de ces 5 enjeux-là. Il faut reconnaître que ces enjeux prioritaires ne sont pas isolés. Ils sont interconnectés et complémentaires. Aussi, ils n'affecteront pas toutes les femmes de la même manière. Ça va varier selon la langue, la classe sociale, la race, l'orientation sexuelle et tout autre élément qui compose l'identité des femmes et qui définissent leurs caractéristiques sociales. Chacun de ces enjeux prioritaires comprend également un grand nombre de dossiers spécifiques.
So we're going to try and do something a little different tonight with this forum. To respect the complex, nuanced, and layered stories that women shared with us, our facilitator, Nadine Duguay-Lemay, who is the CEO of Dialogue New Brunswick, won't be asking any single issue questions. Instead, she's going to lay out a priority area from Resonate and then share stories directly from women about how issues in this area have affected them. Then, she's simply going to ask leaders to explain their commitment to and vision for addressing these challenges. Commitment and vision are what we're going to come back to over and over again tonight. We also want to thank the more than 1,300 New Brunswick women who participated in Resonate, as well as the organizations that supported them in doing so. Our in-person audience tonight is, in fact, made up mostly of people who work or volunteer with organizations that serve, support, and advocate for women and girls, as well as New Brunswick Women's Council members. To organizations and to council members, thank you for being here, and thank you for all of the work that you do in our province. And of course, we want to thank the folks who are watching at home as well for tuning in, and to the leaders for participating in this important discussion. Online, we're using the hashtag ResonateNB and Résonance NB to connect our conversations if you want to participate there. Now, before we begin the actual forum, I'd like to invite UNB Elder in Residence, Imelda Purley, up to welcome us to the unceded land of the Wolastoqey people that we are gathered on tonight. After Imelda welcomes us, Nadine will begin the forum right away. Do you want me to hold the mic for you? Or do you...
I can do it, yeah. Talking walking stick. Kolasik open. Wolastoqey gedneland nekayong kasi ulit pinmanen. Tiket na lawi kud manen wajigel wa walanke yudemek. Yuktak idmotog nagamauchag nikani kabuok nakawalanke yudmen yapsu yudi ayik Wolastoqey. Kdachidena mikwida hama nikanabazitit. Negmau yudtat ligini da hazoltog wajin nekayo de walanke yudemek kitak migumen. Wolastoqey nakaknijanuk. I welcome you to our unceded traditional territory. This tonight is a good reminder of treaty relationships. We are all treaty relatives. In our language, treaty is lagudwagan. That means ones who are related. Ones who share land, ones who share air, ones who share territory, ones who share the goodness of what we can do as a community, as both males and females. And in our leaderships, I was checking to see how many were wearing moccasins, because in our culture, our leaders wear moccasins to be humble, to give gratitude and honor to the four-leggeds. We carry eagle fans or eagle wings or eagle feathers to be connected to the element of air and how our words resonate, which is a good word for your hashtag, how our words resonate with the ones, our air clan. We also want to make sure that we bless your thinking. When we had councils, there would always be a council fire. We never started anything or any dialogue without a council fire because it was important to light that fire as a symbol of our passion, of what we want for each and every one of us, our families, our future generations. So it was important to always have a council fire. We also have to give gratitude for the 2 ears and the 1 mouth. The 2 ears are for listening to each other, hearing all languages, to speak from the heart, where there's always room in our heart to make sure that what we have and keep in our hearts, it's not just something we have to be elected for, something we're going to do whether we're elected or not. We have a responsibility to future generations. Tachiwalas welcome yuktiksil ebol titit ginida hamak enog tachwich kaksan giman which is sankewo satit. I'm proud of all of the candidates that are here, but it's up to us. They can't do all the work. It's up to us to either hold their hand and pull them towards our concerns or go from behind and push them forward so that they don't lose their way. That's what we do as a province. That's what we should be doing as a province. Let's also remember, since we're talking about women issues, I purposely wore my beaded, beautiful, medallion for the murdered, missing, and Indigenous women and girls. And I wanted to make sure that was a concern, which I know it is, because I've known some of the leaders have marched with us, have come to vigils with us, and have walked with us. And so that's an important concern. So I really appreciate all your ears, all your, your voices, your hands for the work that you'll have to do after tonight, whether it's writing, whether it's supporting, whether it's volunteering. It's for all of us. It's not just up to the leaders. And make sure we bless our feet, and more moccasins would be good. But we have to work on that. So, Waliwan, mulas welcome you to Ayultiag, Waliwan Epijik, Ayultiag, I'm Balida Hamsid Gilwa, Ayultiag, Object Sagligabulti. I'm proud to see some of my Aboriginal sisters and aunties here, so that they will be here and have a voice as well. So, Waliwan, for your listening, for your vision, and for your journey here, and may our earth walk, all of us, walk in a good path and in leadership, because all of us can be leaders. We just have to lead the way. Waliwan.
Alors, bonsoir tout le monde. Ça va bien? Oh, on peut faire mieux que ça. Ça va bien? Voilà. Oui. Bienvenue. C'est un grand plaisir pour moi d'animer ce forum. C'est vraiment un honneur et vraiment, je souhaite d'abord remercier évidemment nos chefs qui sont tous ici. Alors, premièrement, M. David Kuhn, M. Blaine Higgs, M. Brian Gallant, Ms. Jennifer McKenzie et M. Chris Austin. Merci beaucoup d'être ici. Alors, le format du forum est le suivant. Une allocution d'ouverture d'une durée de 3 minutes par chef, suivie par une question portant sur chacun des 5 enjeux prioritaires qui ont été identifiés par le biais de l'initiative menée par le Conseil, Résonance. Et c'est ce que nous avons entendu plus tôt. Les chefs auront par la suite 2 minutes pour répondre aux questions et ensuite, nous aurons une discussion de 5 minutes sur le sujet et j'insiste sur le mot « discussion » parce que ce n'est pas un débat. Durant cette discussion, les chefs vont parler un à la fois afin de veiller à ce que notre événement demeure accessible à toutes et tous. Je vais poser les 3 premières questions en anglais et les 2 dernières en français, et les chefs sont invités à répondre dans la langue officielle de leur choix. Lorsque les 5 principaux enjeux seront abordés, les chefs auront 3 minutes afin de présenter leur allocution de clôture. Maintenant, nous avons des gardiennes de temps. Est-ce qu'elles peuvent s'identifier juste ici? Donc, les gardiennes du temps sont installées juste en avant et elles vont signaler les chefs lorsqu'ils auront écoulé la moitié de leur temps. Donc, qu'est-ce que ça a l'air? Donc, vert, c'est ça pour la moitié du temps. Lorsqu'il reste 30 secondes, c'est jaune. 30 secondes, c'est jaune. Oui. Et puis, lorsqu'il y a 5 secondes qui restent, c'est rouge. Je vous rassure, ça n'a rien à rapport avec les couleurs de parti, c'est vraiment le code couleur circulation, hein? Jaune, rouge, vert. Alors, elles vont procéder de la même façon lors de la discussion de 5 minutes, OK, entre les chefs. Et il a été demandé aux personnes dans la salle de ne pas applaudir et de ne pas manifester leur réaction avant la fin du forum. Donc, just before we began, we drew names to establish the order in which the leaders would be seated and speak. You can guess the way this is going to be. So we will begin opening statements with Mr. Kuhn and work our way down the line. Leaders, would you please speak to your commitment and vision for women's equality in New Brunswick? You have 3 minutes each, starting now. Mr. Kuhn.
Merci beaucoup. Good evening, everyone. Bonsoir à tous et à toutes. C'est formidable d'assister au forum sur l'avenir des femmes, l'égalité des femmes au Nouveau-Brunswick ce soir. In the past 4 years, these chairs are quite comfortable, so I'm going to set up. So I use my time wisely. I don't want to be too laid back here. In the past 4 years, we've debated a number of bills that were designed to have positive change, make positive change for women, which I was pleased to support. And more work, though, is needed. More needs to be done. I've got 2 daughters who are soon going to be finishing school and launching out into the work world. Like all parents, my wife and I have tried to raise them with good values and to be confident and believe in themselves. But discrimination and violence against women persists in society, which is why government has such an important role to act to protect and empower women. More needs to be done, particularly, for example, to assist women who are making transitions in their lives from into the workforce or from an abusive relationship or into retirement. I'll always remember my mother when she went back into the workforce after raising us as a single mother, how exhausting it was for her, how the stress and the anxiety of trying to pull enough money together to make a living weighed on her. So we need to find ways of supporting women making transitions. Working with women in my riding week in and week out as the MLA for Fredericton South over the past 4 years, I've seen that very clearly with challenges that women face with the system of social development, whether it's dealing with income assistance or housing or child protection. We really need some fundamental systemic change there. Just before the election campaign, before the writ dropped, I had a woman who had recently left a transition house with her family, and social development closed the file on her children, and she was very concerned about, this is the child protection file, very concerned about that. And thankfully, just before the election began, I was able to convince the powers that be there that they actually needed to open a new file to ensure that those children were safe and she didn't have to fear for their safety. So those are the kinds of issues that help inform and have helped inform my thinking about this and the work I do. So, as I said, tinkering with the system is not enough. We need systemic change. We need a Department of Social Development, in fact, that treats a system that treats people like we would want them to treat our sisters or our mothers or our children. That's what we need. The workforce, really, that fast? It's these chairs. Okay. I timed this, so it was good. Anyway, it's wonderful, I'll say, to be it's amazing to run with the wonderful women on my slate from around the province. And I'm looking forward to the forum this evening. Thanks very much.
Mr. Blaine Hicks.
Bonsoir tout le monde. You may ask yourself, what does a man in his 60s, early 60s I might add, know about women's issues? Well, the fact is, I have had the pleasure and the good fortune to work with strong women in senior levels of responsibility, including in my chief of staff role, directors of communication and media relations, and the many strong female candidates that we have in this election cycle, ministers, deputy ministers, while I was in government back a few years ago. I've served alongside of and proud to work with because the contributions were many. I'm proud to say that these voices were heard loud and clear. They are heard in our boardrooms, they are heard in our caucus meetings, and they must be. And most importantly, those strong opinions are reflected in our platform and in our policy. I'm constantly learning, and I'm amazed at the challenges that women face in the workplace and in their daily lives, and how different it is still from my own experience as a man. I'm committed to learning more, and I want New Brunswickers to be better educated as well. So that means we have to support groups like the Women's Council, and I'm committed to doing just that. I've also committed in forming a new advisory council on women's health, and I've committed to a $5 million endowment to get that started on the important job of better learning and educating others on understanding gender as a critical variable in women's health. I would like to thank Kathy Cofield, who I believe is here tonight, and I do know that because I met her in the lobby here coming in, for better educating us all about breast density. When we know better, we do better. And we will because of the attention that she brought to the connection between breast density and the breast cancer issue. I'm proud to say that sharing those breast density test results with patients will be mandated in a future PC government. I know the issues and the challenges you face as women are more complex and varied than what I can ever imagine, and more than what we can cover in 1 hour here tonight. But I want you to know that I'm listening. As I listen across the province, I'm listening tonight. I'm listening to the voices that know a lot more about this subject than I do. I'll never pretend to have all the answers. I pride myself on going to the experts to get help when it comes to solving this province's problems. And you are the experts on women's issues. I am here to share my views and to learn more about yours. So thank you so much for having me here tonight.
Well with time. Mr. Brian Gallant.
Merci mille une fois pour l'invitation. Thank you so much to the Women's Council for organizing this wonderful event. Not only will it allow for a great discussion, but it will raise awareness on important issues facing women's equality in the province. Thank you also very much to anybody that's watching on Facebook or any of the other social media channels, and thank you, of course, to my colleagues and moderators and everybody that's helped organize tonight. Comme votre gouvernement, nous voulons investir pour créer des opportunités. Nous voulons investir pour offrir la gratuité des services de garderie pour les familles qui en ont plus besoin. Nous voulons investir pour offrir la gratuité des frais de scolarité pour les familles qui en ont plus besoin. Nous voulons aider la classe moyenne avec les coûts des garderies et des frais de scolarité. Nous voulons doubler nos investissements dans le Fonds de l'emploi pour les jeunes pour aider à nos jeunes de rester ici et aussi bâtir leur carrière ici. Nous voulons créer une économie plus équitable en augmentant le salaire minimum à 14 $ l'heure. Nous voulons aider les familles avec l'abordabilité de tous les jours en gelant les tarifs d'électricité pour 4 ans pour les familles et les petites entreprises. Et nous voulons s'assurer qu'il va y avoir plus d'argent dans les poches des Nouveau-Brunswickoises et Nouveau-Brunswickois. Et c'est en raison de ça que nous allons imposer l'équité salariale sur des grandes entreprises au Nouveau-Brunswick. We're going to invest to reduce wait times, hire more doctors, hire more nurses, ensure that we're investing in our hospitals' infrastructure and equipment, invest to ensure that rural New Brunswick has the hospital infrastructure and equipment they need, and we also want to create non-urgent care centers to help reduce wait times in our ER systems. We also want to ensure that we have healthy families and communities, and we want to protect our environment. We want to make sure we fight climate change. We want to maintain our moratorium on hydraulic fracturing. We want to put more land aside for conservation, create more parks, and we also want to ensure that we are investing to advance women's equality. Moralement, c'est la bonne chose à faire, il n'y a pas de doute. Mais nos communautés, notre économie, notre société se renforcent lorsque nous investissons pour faire avancer l'égalité des femmes. And that's why I've learned and often try to, from what I've learned, encourage others to not necessarily call them women's issues because they're societal issues. They're issues that impact all of our families, communities, and our economy. Over the last 4 years, I've learned a lot. I've had the chance of being the minister responsible for women's equality. Many of you in this room and many other people across the province have taught me what we need to do in this province to advance women's equality. I think we've accomplished a lot, but I completely agree with Mr. Kuhn. There's still lots to be done. We've been able to eliminate... Well, I saw the red, so I know that's for me here. I'm sure there'll be other time to talk about some of the other things, but I look forward to the discussion tonight, and thank you for the invitation.
Jennifer McKenzie.
It's a real pleasure to be here this evening. I didn't know that I was going to be able to make it tonight until just a few hours ago, so I haven't prepared a lot of notes. I'm going to be speaking from the heart. It's wonderful not to be the only woman on the stage, I do have to say. I'm proud to be the leader of the New Democratic Party of New Brunswick. I'm proud to be a woman leader with the types of leadership skills and practices that brings to the party. And I think we're starting to see a lot of the value in that start to come alive in the party. I made it a huge priority to have 50% women, and I'm very proud to say that we don't just have 49 candidates across the slate, but we have over 50% women on our team of candidates. I sat with some colleagues, and we needed to redefine the NDP, and we decided we would do that by releasing a series of planks or ribs that sort of told New Brunswick who we are and what we stood for. And the first three were minimum wage, child care, and home care. And it didn't twig to me until, several weeks later that these are really strong women's issues. Minimum wage are 36% of the workers in New Brunswick make less than $15 an hour, and over 50% of those, or typically 50% more women than men, are in this category. And I see that when I knock on the doors. Childcare, we would create 20,000 new spaces in schools to help women and men re-enter the workforce, and 4,000 new preschool spaces. Again, a very predominantly women's issue. Home care, we have taken to increase the amount of home care while we return the extramural program under the public sphere. We would augment that with home care to allow more people to stay in their homes with support. Again, not just exclusively a woman's issue, but many women are tasked with looking after seniors and the people who are sick at home. Post-secondary education, we also looked at environmental leadership, clearly a key issue for women and men. We also agreed to improve the nursing home ratios of care effective immediately in our nursing homes, because that, again, many of the workers in the nursing homes who are working extremely hard and in very difficult conditions are women. And I'm down to my last 5 seconds, so there you go.
Chris Austin.
Great, thank you very much. I just want to take the opportunity to thank everyone for being here and being a part of this forum. And I can tell you from the heart, as a 39-year-old male, I am constantly learning about issues that women face either in the workforce or in society at large, and certainly open to what government can do better to make the system fair for everyone. I can tell you I grew up in a home where we struggled growing up as children. My mother worked very hard in a cabinet factory, making a little better than minimum wage. And, growing up in that type of childhood, you certainly learn the value of a dollar. And, I certainly sympathize with others who have to struggle in that same sort of livelihood in their own world, I guess. I can tell you from a party perspective, we have had in the last several years, presidents of our board have been strong females who have worked hard to build structure within our party and to advance our movement and our message to the people of New Brunswick, which we are very proud of. We also have more female candidates this election than we've had in the past, and we're proud of that as well. And again, I guess my role as leader is to listen and to discern the issues that are brought forward, and we're certainly open to doing that. One policy I do want to mention that we have constantly fought for is home support workers, not only to assist seniors living in their homes, but those that work that job every day. My wife did it for a couple years, and again, making a little better than minimum wage at that time, working 20 hours a week and traveling all over the region to help seniors stay in their home seemed like an injustice to the work that she had to put into that. So we fought for that. They need a fair and reasonable wage to be able to do their job effectively and, again, help seniors stay in their homes. So we will continue to fight for home support workers and make sure that they get the wage that is reasonable for the work that they do. And we're, again, also open to looking at other issues. If there's inequality with wages and in the workforce in other areas, as a party, we're certainly willing and open to address that and to form policies based on that going forward. So thank you very much again for having me here, and I look forward to the discussion and learning more from the Women's Council. Thank you very much.
Thank you to all. So before we continue, I just want to do a quick pulse check. Are we all comfortable? Is anything missing? We're too comfortable. Okay. Well, we're getting into the meat of things here. Okay. So now we move on to the questions that were identified in Resonate. First one, health. Health was one of the priority issue areas identified in Resonate. Within health, women frequently talked about challenges relating to accessing mental health supports and services, accessing reproductive health care such as pap tests, birth control, midwifery, and abortion, and meeting basic health care needs, which included having a primary health care provider. Here's what women share about this priority area in their lives. As a young woman, I have been receiving annual pap tests with my female doctor while out of the province for university. When I came back to New Brunswick and asked my male family doctor for my regular pap, I was told to find a clinic or go elsewhere. That was 2 years ago. I have yet to have a follow-up. There is no support nor guidance provided. Second women. Many people don't have access to a family doctor and rely on the ER or walk-in clinics. This is a poor way to service health care and it makes access to simple things like birth control or chronic health meds more difficult than it should be, and I'm sure it costs the systems more in the long run. Third woman, we focus too much on healing and not enough on prevention. It would cost less to government and women would be in better physical and mental health. Do you know how hard it is to get a family doctor? I waited 4 years to get one before I could finally start talking about mental health issues that the walk-in clinics didn't want to hear. We've heard from these women as laid out in the Resonate report. Please speak to your commitment and vision for addressing health care as a priority area that affects women's lives and equality in New Brunswick. We will start now with Mr. Higgs.
Thank you. Thank you very much. I've only learned recently that we are basing our education on women's health off of male health models. For example, heart disease, we now know that women and men's symptoms present very differently. Because they are presented differently, women weren't being diagnosed as quickly as they should have been, and treatment has been delayed. And that is just one example. Another research is on head injuries. Under a male model of health, most men get concussions from sports injuries. I was shocked to learn that most recent research shows women often get head injuries because of domestic violence, but that the injury is often unreported, and they may be getting treatment for depression on other mental issues when in fact it's a brain injury as a result of domestic violence. There will be exact type of health issues our Women's Health Council will study, and I'm asking to find the priorities that we need to work on. I also know that in New Brunswick we have the longest wait time list for surgery in New Brunswick, in gynecological surgery. The wait is 77 weeks, long enough to have 2 full-term babies. That is unacceptable. Our government is committed to addressing women's health. As a result, we've set up the Women's Council and the $5 million. But what I guess concerns me the most is we are spending a lot of money in healthcare, but we're not getting the results. Our wait times are last in the country in every sector. And I believe that we can do better by focusing on real priorities. And that is why certainly we've made changes on our platform when we put it together, looking at mental health issues in relation to the youth. About 3,000 that are waiting years to get assessed. So this issue goes far beyond women's issues. It goes into health in general in the province. But we're focused in the council to say, you tell us where the priorities are. Because these stories just have to change. They have to stop. We have to get better results. And that is our focus. Results for women's issues, results for healthcare in New Brunswick.
Thank you. Mr. Gela?
Merci beaucoup. Very clearly, when women are healthier, our communities are healthier, our families are healthier, and our economy is healthier. I spoke quickly about some of the things we'll invest in to reduce wait times in the province. Let me add a little more specificity. We'll invest to continue to hire more doctors. Since we've been the government, 300 doctors have been hired. That has given us 90 more doctors today than we had when we became the government. We will invest to hire another 90 net gain of doctors in the province to help reduce wait times. We will hire 40 more nurses, a net gain of 40 more nurses, 50 more nurse practitioners, and 80 more LPNs, all with the goal of helping to reduce wait times. The non-urgent care centers that we'll create will also help ensure that we're reducing wait times in our ERs. Nous allons aussi investir dans nos infrastructures, évidemment, pour donner aux professionnels de la santé ce qu'ils ont besoin pour être capables de desservir la population. When it comes to reproductive health, for 30 years in this province, there was a 2-doctor rule that meant that New Brunswick was not respecting a woman's right to choose. We, after 30 years, finally got rid of it. We have also ensured that there's free access to MIFI, and a re-elected Liberal government will make sure there's also free access for Health Canada-approved contraceptions for women in this province. We're also the ones that restored funding to midwifery that was cut just before us. We started the pilot program here in Fredericton, and we'll invest to make sure that program is a continued success, and we'll invest to roll it out to other regions across the province. De plus, nous allons investir, bien sûr, dans la prévention. C'est très important d'essayer de faire en sorte que nos familles soient en santé au lieu de toujours guérir. Je suis complètement d'accord avec ça. And we as well are going to ensure that breast density information from mammograms are given to the patient and the family doctor or primary care delivery, so we can ensure that they are more aware of the risks of breast cancer for them and their family. Merci.
Thank you. I'm going to take it as a given that breast density information should be given to women. The NDP would start by investing in schools and putting public health nurses, psychologists, all social workers, all the other types of supports that we need in schools to support students and remove barriers to learning. We would also restructure or study the way that we deliver health care in the province to allow more preventative care, to allow more community-based care, so that people can get the type of preventative health care that they need in their community close to home. We would hire the doctors to fill the vacancies that we need to that haven't been hired, and also look at hiring 100 new nurse practitioners to help support the community-based care and in other places where they are needed to help alleviate a lot of the wait times and stresses on the system. We have put mental health services into post-secondary education because when we talk to the youth who are attending post-secondary institutions, they are under a lot of stress. When I spoke with some nurses who were in the nursing program, they said that 90% of them had accessed mental health supports in the school. We would increase the capacity of the two schools that educate nurses. We would increase the capacity of the program at UNBSJ for training doctors and expand it to look at how we might produce some of our own specialists so that we can have New Brunswick students working in New Brunswick in the types of medical care and delivery that we want to have here. As a woman, I think that the health care that we have is very male oriented and would like to see much more female oriented care provided.
Great, thank you. There's no question health care is going to be probably one of the most important issues of this election. Health care in New Brunswick is at a crisis mode. Let's not fool ourselves. We have hallways filled with beds at oftentimes of overcrowded hospitals. We have waiting areas that have been repurposed for patients to be plugged into. I'm even hearing so much as ambulances now are waiting to undock patients for extended periods because, again, overcrowding. We have to tackle the healthcare issue. Not just for women, but for society as a whole, so that we can all benefit from a good, strong healthcare system. To do that, the People's Alliance has committed to less administration. That's why we've called for a merging of the two health authorities, so less money is spent on top end, more money spent on physicians and nurses on the front line. We've also called for several years now for an elimination of the doctor billing system. It's outdated. We're the only province in Canada that does it this way. And as a result, physicians that want to practice in New Brunswick but are not allowed to practice in certain regions choose to go somewhere else. And we lose the opportunity for highly skilled, qualified physicians and specialists to fill the roles that are needed here in New Brunswick. We've also called for government to have professional recruitment organizations to come in and get new doctors in. And while we're waiting for new doctors to come in, we would also utilize nurse practitioners. Nurse practitioners are highly underutilized in New Brunswick today. They can diagnose, they can prescribe, and they can give specialist appointments for many issues. So they're underutilized. We will utilize them while we are recruiting family physicians so that health care is available for women as well. Thank you.
And lastly, Mr. Cooling.
Merci beaucoup. I'm going to lean forward so I go quicker. So I want to talk about two things, equality of access and accessibility overall to the health system. So in terms of equality of access, we have midwives in the Fredericton region but nowhere else. And I don't have time to sing the praises of the benefits of midwifery in this province to families and babies. But the Green government would ensure midwives were hired in each of our health regions, the 7 health regions around the province. There particularly would make also a special help in our rural areas that where right now women have to travel long distances for appointments and so on. Secondly, right now in terms of accessing abortions, it's really, in terms of publicly funded abortions, it's just Moncton and Bathurst. That's it. There's no equality of access. You can pay for an abortion if you've got the money at Clinic 554 in Fredericton. So we would want to make sure that all regions, abortions are available in all regions of the province. We can start in Fredericton by ensuring that publicly funded abortions are available at Clinic 554. A deal needs to be made with the clinic. That shouldn't be with Horizon. That shouldn't be difficult to do. We're already losing, with the results of the privatization of the management of extramural, we're losing pediatric physiotherapists and occupational therapists for children in the rural regions of this province in particular, and that is a desperate situation for the parents and for the schools. So we would address those questions of equality of access. With respect to accessibility, One of the things we want to see is the pharmacists working to their full scope of practice to keep women out of emergency rooms so they don't need to be there. So when you've got a UTI, if you can go to the pharmacist and it's covered by Medicare, they can diagnose, prescribe a few minutes, and you're out. Why don't we have that covered? It doesn't make any sense to me. It needs to be. It's covered in many other provinces. We need to, pharmacists have a broad scope of practice. We need to ensure that it's covered. And of course, we are very strong supporters of nurse practitioners, and my time is up.
Sounds like you have a lot to say. Okay, so now we enter into our discussion. There's not going to be any rules here. We're just going to go, who would like to jump in first? Jennifer, please.
I ran out of time before I spoke about our last platform plank, which is pharmacare. The NDP is committed to paying for 50% of the cost of a universal pharmacare program, which we see as being very preventative in terms of keeping people from having to use the healthcare system when they haven't been able to afford the medication that they need in order to stay healthy.
Okay. I think Mr. Gallant had something to add.
Yeah, maybe just a couple quick follow-ups. First off, we very much support as well having a national pharmacare program, which would be universal pharmacare. I don't think it's prudent at this point, where we would certainly want to negotiate with the federal government to try to have them come in at the largest percentage possible, but I can tell you that we would be at the table for that type of program. Also, I know many of my colleagues spoke about mental health, and rightfully so. We would continue to invest more in mental health. We signed a deal with the federal government where we're going to get $100 million from them that we're going to be able to invest in mental health and addiction support over a 10-year period, including programs like integrated service delivery, the FACT team, which is some more cases that might be a little bit more significant than severe. As well, I want to say that we've listened to stakeholders, and we also want to ensure when it comes to mental health that we take a housing-first approach, making sure that we're doing everything we can. And that's also why we'll be investing more in affordable housing, $56 million in additional funds for affordable housing over a 3-year period.
Mr. Kuhn?
Frustrating thing is, Mr. Gallant's had 4 years to address some of these things, and I'm thinking of nurse practitioners in particular. They are primary health care providers. My primary health care provider is a nurse practitioner. That's who I go to, and she's wonderful. But we've got nurse practitioners leaving the province because they're not getting enough hours to keep their licenses up. So that's why it's important, and we would hire 40 nurse practitioners into Horizon, into Vitalité, as well as enabling them to set up practices under Medicare to provide that kind of health care that people need, to eliminate or reduce the waiting lists that are there, and to build, and to also incorporate them into collaborative practices with other health professionals. So we start to move away from this model of the solitary doctor running the whole show and then referring to sort of extraneous health professionals, but a collaborative practice so that you're a patient of a team, perhaps led by a nurse practitioner, like in my case.
Okay, and we have Mr. Higgs.
Thank you. You know, I hear a lot of numbers thrown out about, in case talking about nurse practitioners and how many would be hired. You know, when I talk about listening to people, I recently had an opportunity to meet with the Nurses Union and the NB Nursing Association, and they told me that 25 practitioners would eliminate the 20,000 people that are currently on a wait list to see a doctor. And they said it's not difficult. We could do this. And so when you get that sort of advice from someone who are close to the action, knowing that here's what's needed, you don't need to just throw numbers out there and we'll hire this many more. It's like, how many do we need to make this happen? And how do we offload doctors and such that we can do more critical issues and we can have primary health care when and where it's needed? And you know, the other things that are coming down the pike, of course, are the shortage of nurses coming forward. I mean, over the next 5-10 years, we can have a shortage of nurses or nurses eligible to retire in the 40% range. And you know, we can't wait for that. We need to plan now. We need to have our universities graduating more students so we don't lose ground. We have the capability. We just need the foresight that goes beyond an election cycle and goes into the next 10, 15, and 20 years so our healthcare doesn't deteriorate as it has, despite the amount of money that is spent on it.
Okay, Mr. Hayes. We had Jennifer and then Mr. Gallant that way.
Chris, did you want?
Yeah, well, look.
Well, after that. But they've just been flagging me, and I wanted to give you an opportunity as well. So, okay? Quickly, sure. Jennifer, quickly, Brian, and then Chris.
Quickly wanted to rebut to Mr. Gaunt's comments. When he negotiated the health care deal with the federal government, he did not include a factor for aging. And as we age, our costs of being given health care go up. Someone over 65 is about 5 times more costly to provide health care for. And so our costs are going to go up like this, and our funding is going to go up like this. $100 million over 10 years for mental health doesn't even begin to address that gap.
Okay, very quickly, we're going to be out of time, so one last statement. And then
2 points I need to make, because I have to correct what was said. So $230 million in over 10 years is going to be invested into mental health and home care because of the deal that we signed with the federal government, and we signed a deal for $75 million when it comes to senior care over 3 years. Yes, no other province got it, so that's great. And Mr. Kuhn, what you said about the collaborative approach, I completely agree 100%. That's exactly what we have with Family Medicine New Brunswick. We have people setting up in Fredericton like that, and St. John and other regions of the province where it's a collaborative model with family doctors and other allied health members. So exactly the model that you discussed, and I agree with that, and hopefully you'll support it.
And he hasn't rebutted what I said at all.
Oh, okay, but this is not a debate. Let's remember this.
We don't want this to turn into CBC.
Chris, we're out of time. I do want to signal that, but we want to give you the opportunity to say something.
Great. No, I guess the point that I would like to raise is, people refer to healthcare, and I think rightfully so, as this big black hole where you can throw all the money you want at it without getting any real results out of it. So I think it's got to be a different shift of just simply throwing money at healthcare. I think at the end of the day, we got to realize that the issues we see today in healthcare, it didn't happen overnight. We can't just blame the current government. We have to look over the last 15 years of a declining healthcare service, and it's got to be readapted. We have to look outside the box to make sure that it does work on a local level as well.
I thought I was covering it. I made it worse. Sorry about that. Apologies. Sorry.
I'm not sure where to go from here, but Does somebody have a doctor in the room?
Sorry about that.
But really, I mean, we have to do it different in management, and I guess that's the point I want to make is, again, these problems didn't happen overnight, and they certainly can't be fixed overnight, but we have to think differently about healthcare.
Okay. I think I'm going to introduce new rules for the next time around.
I can get people to stop talking after that.
Okay, so we're moving on. Thank you so much for sharing your thoughts and vision regarding health. Now we move on to employment and economic security. Women who discuss economic security and employment as a priority area talked about poverty and meeting basic needs, employment, pay equity, and general concerns about wages, income, and financial security. Here's what women told us about this priority area in their lives. First one. Sometimes we can't afford groceries for the month. Sometimes I literally eat frosting for a meal because I need some sort of calories to function. Second woman. I feel the government, all, not just this one, does not fully appreciate that most community services function on the backs of underpaid women. As government offloads more and more work onto nonprofit services, women are increasingly feeling the effects, including physical and mental health, issues around poverty and childcare, and more. Third one. Because I am disabled and can't work, I am limited to living on CPP disability, which pays me $555 per month. My rent is $700. I am unable to access help. Another one. I believe government should demand pay equity for all workers in New Brunswick. Their fear of adding costs to businesses is not justified because better paid women will contribute more to society, will have better housing, and be healthier. Programs for immigrant women deal only with language issues and are addressed towards low-educated jobs, and definitely do not help immigrant women in rural areas. we are forgotten. Please speak to your commitment to and vision for addressing employment and economic security as a priority area that affects women's lives and equality in New Brunswick. We will start off with Mr. Gallant.
Studies show that there are more women than men living in poverty. And when it comes to any woman and children that are facing a domestic violence situation or any other type of violence, it becomes that much more difficult for them if they don't have the economic security necessary to be able to get out of the situation. I can relate certainly to some of the comments that you made, Nadine, from some of the submissions. My family went through tough times when I was young. My parents worked at fast food restaurants, convenience stores, and grocery stores their whole lives. When I was 10, we went through a pretty rough time, like a lot of New Brunswickers unfortunately have. So I can tell you I know firsthand why it's so important to make sure we're growing the economy. When we took office, the economy from 2011 to 2014 in our province had shrank. It was the only economy of the province that shrank during that time period. We've been investing, and since then the economy has grown every single year. The jobs have grown, where there are 4,000 more full-time jobs today. We have wages that have gone up every single year. Unemployment rate went down from 10.1 to 8.3%. The deficit has been cut by more than half to the point we had a budget surplus. And we have the largest population in the history of our province at the moment. But I understand that there are challenges that are faced by women more than men, so there are policies that we put in place that we know will predominantly help women, but help families in general with the cost of living and revenues. Raising the minimum wage to $14. Studies show minimum wage earners are predominantly women. Freezing power rates for families. Seniors that are on fixed income are very much going to benefit from that, and studies show that seniors in New Brunswick are predominantly women. Ensuring that we impose pay equity on large businesses will help all families and, of course, predominantly help women. And the free tuition program, free childcare program, middle-class support for childcare and tuition are all programs that will help families and help women as well.
Thank you. Ms. McKenzie.
Well, I don't need to say studies show, because when I knock on the doors in St. John, I see the women who are struggling under poverty with small children, and who, will talk to me with tears in their eyes about how it is so impossible to feed their families. It's really important that we raise the minimum wage for workers, particularly women. But our program for universal childcare in every school will make it much easier for women to re-enter the workforce. By creating 20,000 new spaces across the province, we will help women in rural areas, we will help women in urban areas, and everywhere in between. Pay equity is an unmet promise of the Gallant government to women in the private sector, as is nursing home ratios. An NDP government would also create new positions for childcare workers. The early childhood educators in the schools are often women. And home care workers are also predominantly women and are also very poorly treated in terms of their benefits and pay for the work that they do, the important work they do in this province. When I attended at the Social Development Council, their talk about what it is to earn a living wage, our minimum wage proposal plank of $15 an hour instead of $14, plus our childcare program actually adds up very closely to being $18.18 an hour, which is what the Canadian Centre for Policy Alternatives and the Development Council calculated it would be. So I'm very proud of the work we have in our platform and how it helps women.
Mr. Austin.
Great, thank you. I guess to start out, I kind of want to give a little background of my sister, who I'm very proud of. She's a year younger than I am, but at a young age, 15 actually, she had her first child, and then she had her second one a few years later, and struggled, as a student and as a female raising two children, as a single mom. One thing I will say about her is her perseverance and her diligence, and she was able to, with the help of family, get out of that and get into university, where she took nursing. She worked hard, again, with the help of family, financial support, as well as helping with the children and that sort of thing. And today, she's a very proud registered nurse in St. John. And I can tell you that watching that and growing up with that, if she didn't have family help, the outcome probably would have been much different. And, it kind of opens your eyes, I guess, to society and to say the women that are out there that are facing the same things, that do not have the support of family, what can government do? Not to give a hand out, per se, but a hand up to help them getting to university in whatever a field they choose to take, to better their lives, their children's lives, and society as a whole. So that's certainly something we're always looking to solutions for, and we're very open-minded to how to make that work, especially for, again, women that find themselves in that situation.
Thank you. Mr. Kuhn.
Merci, Nadine. Okay, so we would do something, a Green government would do something very quickly that would have significant impacts on women and others living in poverty. Three of us here agree the minimum wage needs to go up, but a third of people living in poverty are forced to live on income assistance, and a lot of those are women. What we would do is eliminate the clawbacks. Right now, women who are supposed to be getting child support have their child support taken away by the Department of Social Development. It's gone if they're on income assistance. There are so many rules that prevent women from getting ahead. If you're older and you've got a disability pension, a small disability pension from the federal level, and you're on income assistance, it's taken away. So we would eliminate those clawbacks so that women have a chance to get ahead, to make their money go a little further. And that would have a big difference right away, overnight. We would increase income assistance rates as well right away, because it's necessary, and index them to inflation. But those kinds of things would make an immediate positive impact on the lives of women who are living in poverty in this province. For the longer term, we would establish a basic income guarantee. We would start with 3 pilot projects in different regions of the province, and then roll out across the province. My vision of this is that New Brunswick would become known as the home of the basic income guarantee, which then ultimately would roll out across Canada. And this would be set to match the market basket threshold for making sure everyone can receive sufficient money to meet their basic needs for food, shelter, and so on. We've got to ensure we have affordable housing, and that is the other area that I would focus on. It's the number one issue that's come into my constituency office over the last 4 years, with women with disabilities living in rooming houses that were dangerous, whose file had fallen through the cracks at social development. Or women whose children had aged out of the child tax credit and were going to lose their apartments because they couldn't afford to keep them.
Mr. Higgs.
Poverty, 1 in 5 New Brunswick children are living in poverty. And that is 21%, and the biggest reason that they are in single-parent homes, specifically single mothers. So how do we help these women who are trying to get out of the system and provide a quality of life for the children? I think in the current system, and I hear what David is saying in relation to, under the current system, a mother and social system wants to work, even part-time. So I think of it a little differently. Even part-time, to go out and earn a little extra, it's clawed back. And so that the incentive to do so just isn't there. We take it out of the social assistance payment, and that is just wrong. I'll tell you, in case of what else is wrong, we have, again, mothers who are on social assistance, and any amount of money that the children's father contributes is, again, clawed back. That money could be used to help feed, clothe children, but it is being clawed back. We need to fix that. We need to get out of the cycle of dependency and allow young mothers, young families, to earn more when they want and have that opportunity. And I've talked to developers about their buildings and on social subsidized housing. And you know what they've told me? They said, after we have they've put the money in, government has funded a portion of the building to help people be able to live there comfortably. They said, we could let those apartments become condos and the people that are living there become owners. So after the 20 years, it's a time when they could actually take ownership. So what does that mean? They see a future. They see a pride of ownership. The developer says we both win because we would both be seeing the buildings would be better looked after, the people living there would see a future, and they would see an opportunity to get out of the cycle. Thinking in innovative ways to create a vision for people to succeed and see a future. I think the biggest challenge is people get into a cycle and they don't see a future, their kids don't see a future, and the cycle continues.
Okay. We're about to start our discussion, so now I'm going to introduce new rules because I'm the moderator and I have that right, apparently. So I was just signaled by Mr. Brian Gallant that he wanted to speak first, so he has that right. Did it work for you before, just to signal me? Okay, we will do that. Remember, it's not a debate. We're just going to please state in short answers. Let's keep it to a 30-second. That's going to be my other rule for my timekeepers. And we'll just continue that way. Okay, Mr. Gallant.
Very interesting comments by all the leaders. Two of them raised something that I think is very important, talking about children living in poverty and how many of them it's because they have single mothers, single parents maybe, but often predominantly single mothers. Mr. Austin certainly had a very powerful story about his sister, who's obviously an incredible person who's been through a lot and is and should be commended for it. But both asked what we can do for people like that. Free tuition and free childcare is what we can do for people like that. Free tuition and free childcare is exactly what's going to help people in that situation go into the workplace or go to school for free so they can change their lives forever and change their children's lives forever.
Thank you. Jennifer?
It's really important that social programs be universal. It's important that everybody uses, Tommy Douglas, when he invented health care, the same is true for public education. The childcare program needs to be universal so that everybody participates and everybody can be part of it and hold it dear. It's really important that our schools and our childcares be inclusive so that children with disabilities can stay in school and can stay in the childcare. And those are some of the... My time is up. It's hard to fit it all into 30 seconds.
I wasn't flashback. Oh, okay, Mr. Kuhn.
Well, I just wanted to say, because I mentioned housing, affordable housing was the biggest issue over the last 4 years I've heard in my riding, and I've been working with people, and mostly women, mostly single parents. We really need to up our support there, and one way we would do it as a Green government is to put in place more rent supplements for people so that it's attached to the person rather than to the landlord, which would make a huge difference in many people's cases and help avoid eviction, which happens regularly. And if you're evicted and you have children, you're scared to death, of course, your children are going to be taken away. And people spiral down into a real crisis when that happens, of course.
We have Mr. Austin and then Mr. Gallant.
Yeah, I just another point I want to raise is our policy fiscally. We've talked about tax reform. Part of that tax reform would include the elimination of the double tax. And what we would also include in legislation is to make sure that rental rates are frozen for 3 years so that the most vulnerable get the opportunity to benefit from the double tax elimination. So it's not just the landlords that would pocket the money, but that it would trickle down to people that need it the most. We want a system that works for everybody, and tax reform would be part of that.
Okay, so we have Mr. Gallant, then Ms. McKenzie, Mr. Higgs. Okay, Mr. Gallant.
One way to create more opportunities in a fairer economy is definitely through pay equity, and that's why we have a plan to ensure that it gets into the quasi-public sector and as well get it into large businesses through legislation. We've had, over the last 4 years, some success, though, and I think we should celebrate that. We went from 11% to 7.4% being the gender gap. It's the second lowest of all the provinces in Canada. Many women and people in this room have contributed, and I thank you for it. So we should celebrate those successes, but there's still a gap, and that's why we'll do more.
Ms. McKenzie.
I find it very interesting to hear Mr. Austin start talking about rent control, but I would say that 3 years is going to, go by very quickly for the people on rent. And I also think that Mr. Austin should be starting to talk about where the money is going to come from when he eliminates the double tax. We are calling for a full review of the property tax system, as Mr. Gallant promised in the last election, and making sure that it's fair for renters and also people on low incomes and other types of housing.
Mr. Higgs.
I think the challenge we have in prescribing a formula in terms of wages is that what we have right now is we've lost 6,000 jobs in the private sector. We've lost investment in our province in the private sector. And a lot of that has to do with the taxes, the structure here that is not comparable to other provinces. We're last place in economic growth. We can, Brian and I can talk about the money invested, but we're last place in the country. So we see this decline, last place in medium income. We're last place in healthcare. We're second to last in education. So I think the point of looking for the gender equality in pay and absolutely equal pay for jobs and gender is not an issue is never been a debate. It's legislated and it's never been a debate. It should never be a debate. But I think we have to compare with other regions. We have to compare with other provinces. And we have to make sure we stay competitive.
So we had Mr. Austin, Mr. Galland. I just wanted to do a quick time check. Are we okay? 5 minutes. We're at 5 minutes, so we will stop with those two last interventions.
Yeah, I just thank Mrs. McKenzie for bringing that up. First of all, we can't afford not to eliminate the double tax. New Brunswick is one of the highest tax provinces in Canada. We're the only province in Canada that has this ridiculous double tax, which doesn't only affect landlords, but it affects business owners and people with second properties. The amount of investment that goes away from this province because of the double tax is what's killing the economy here. Less taxes means more investment. And in terms of the 3-year freeze on rates, after the 3 years, we're fully confident the market would correct itself, and as it does in other provinces, and rental rates would actually go down because of the elimination of double tax. That's why we're such strong proponents of it.
Okay. Mr. Galland.
Blaine Higgs' cuts as the Minister of Finance led to a shrinking economy from 2011 to 2014. It was the only economy of the provinces of Canada that shrank, so he was in last place. Over our mandate, we had the third largest growth rate in 2015. 2016 was around the Canadian average rate. 2017 grew again. 2018 projections said it will grow again. 4,000 more full-time jobs. Unemployment rate gone down almost 2 percentage points, with wages going up every single year over the last 4 years.
That was right on time. I'm sorry, Mr. Hicks, did I miss something?
No, I thought the last was going with Mr. Austin and Ms. McKenzie, but I know we're not rebutting here.
We just keep saying the stop signs. We're not sure.
Yeah, the stop signs are up, but the voices continue. We are last place in the country today at a time when economic growth is moving forward. We're spending at 3 times. The government today is spending at 3 times the growth rate in our economy. And so as a result, we've seen people leave the province. We've seen investment down, 6,000 private sector jobs down, and last place in every sector. So it's pretty hard to argue with the comparisons that exist between provinces.
Before we move on, I'm going to be fair. Mr. Kuhn, did you have anything else to add to the discussion?
Well, I think we should get back to the question, maybe to finish with, and housing. And the last thing I want to say about housing is we've had organizations in Fredericton, St. John, and Moncton who put together housing strategies to house the homeless and wrap services around them. So that's the housing first idea. But no funding has been coming forth to implement those. And that's what we've had for the last 8 years. We hear Mr. Higgs and Mr. Gallant talk about all these things now that they think they want to do, but they had 8 years to do that and they didn't do it.
All right. Thank you so much for this discussion. We're improving each time. We're doing great. So we're just going to keep checking in. The red was just for time so that we're, concerned nobody monopolizes anything. Okay, so moving on to our third priority issue, which is accessing and providing care. When women describe accessing and providing care as a priority area, the following key themes emerged. Access to affordable and quality childcare, and how this impacts economic security, employment, and career trajectories, and health. Support for parents related to financial, legal, and childcare support. Informal caregiving for family members or friends, and the challenges related to work-life balance. Here's what women told us about the priority areas in their life. The first one. Authorities seem to ignore the huge responsibilities that adult women face by having to take care of their aging parents. This requires time, having to travel on a regular basis. I feel caught between my children and the increasing needs of my parents. Second one, it is oppression of woman. She must choose to work hard all week away from her baby and then spend 90% of that paycheck on childcare. There is almost no point when you take in travel time and costs. Third one, my disabled husband on the reserve doesn't qualify for a lot of help since provincial programs don't apply on the reserve, and therefore I, as his wife, have to do the majority of the unpaid care work. We live below poverty lines. I can't leave reserve because then we lose our housing. And last one, lack of support for female caregivers within the system and the poor pay within the home care services system. The majority of their employees are women. I have watched my grandmother, mother, and friends struggle through exhaustion and frustration because they are the primary caregiver for an ill or disabled family member. In fact, my mother is going through this experience right now. Please speak to your commitment to and vision for addressing the provision of and access to care as a priority area that affects women's lives and equality in New Brunswick. We shall start with Ms. Mackenzie.
Thank you for these wonderful topics. I'm very proud of our childcare plan. It would create 20,000 new spaces, and they would be accessible, universally available, zero wait times. But most importantly, they would be in every corner of the province, whether it be rural or urban. If you put the childcare in the schools where the children go, the other children in the family as well, you eliminate the need for travel time during the day, which is another worry for young families. I think we have to look at things like nursing home ratios so that people don't feel that they have to go and make sure that their elderly relatives and friends are receiving adequate care. We would increase the nursing home ratios immediately. The home care, we would put all home care workers under an agency so that we could make sure that their working conditions and their remuneration were fair, and that we could make sure that they were treated well. We also want to make sure that families can, women especially who are caught in the sandwich generation, are not spending full time working on looking after both their parents and their children and grandchildren. We see a great deal of this going on when I go around to the different doors, grandmothers looking after grandchildren, and a lot of our programs will be very helpful to support the families that are out there.
Thank you. Mr. Austin?
Thank you. When we talk about providing care to those that need it, again, not to make it personal, but my wife is one who does just that. She worked with a lady with special needs at a local organization in our community, and both her parents passed away, and she needed a place to live. So my wife took on the alternate family living arrangement where we brought this lady into our home where she provides 24/7 care for this lady with special needs. And I can tell you that financially, it's a strain. I mean, it's very low income that she receives. And again, not that anybody's looking to make money off of this, but it is a compassionate thing. But we do need to look at what can be done to help people with special needs and the care that is required for those people. So what we have talked about is increasing the allotment, not just for the one caring for this person, but for the person themselves to be able to get the things that they need, on a day-to-day basis. We've also talked about home support workers. Again, they're the lowest paid in the country, something like $12, $13 an hour. They need a fair and reasonable wage, and this is a line of work that, let's face it, is mostly dominated by women. And there's a benefit there to paying them a good wage, a reasonable wage, again, not only to help them, but help the seniors that are living in their homes.
Okay. Mr. Kuhn.
Thank you, Nadine. So there is a crisis of care in the provinces, for sure, and I was struck by the number of older women I've met at the door during the campaign who were surprised that when they went looking for home support in the last little while, because of all the rhetoric, both over the last 4 years and before that with the former government of the priority of helping to keep seniors in their homes, they were surprised to find that they couldn't find the care when their husband had injured themselves, broken a hip, or become ill in another way, and didn't know what to do. They didn't want to go to a nursing home or have them go to a nursing home, but the support just wasn't there. So there's a huge recruitment and retention crisis in the home care sector. So immediately what we would do is we would start raising the salaries for home care workers, $5 an hour over 4 years. We would ensure that there's better and more effective training, and that their costs and time are covered when they're traveling between clients. This is a big deal, especially in rural areas where you're traveling 20 minutes or longer between clients. You're not paid for that time. The other thing I think would be really important and helpful is for those support workers, home support workers who are providing a high level of support, that we knit those together with our extramural nurses once we bring them back into the public health system and cancel the Medibee contract, so that they can work as a team. And that kind of collaboration between the home support worker and the nurse would be tremendous in terms of increasing the quality of care for those that they're caring for in their homes. On the nursing home side, if people do have to go into nursing homes, we've got to raise, and we would raise, the amount of time that's funded for care. Right now it's 3.1 hours per day. That needs to go at least to 3.5. There's been a good pilot project some years ago that looked at the impact of that. I've spoken with nurses who were involved. They said it was incredible, the difference, so we would make that change.
Mr. Higgs?
So just echoing some of the sentiment in relation to home care, the focus absolutely needs to be on a home care and a wage that makes it a career in health care. A training that gets into the profession, provides the right care at the right time with people when they need it, where they need it. And we're very focused on that. So not cutting ribbons on bricks and mortar, but cutting ribbons on service to individuals, because not a lot of people are standing up and saying, I can't wait to get into a nursing home. We always will need nursing homes, we know that. But we'll never meet our home care or our health care needs as our population ages through that model. We need to have that wages. So we're in very much alignment there. Going to the opportunity for more women to have access to work, and because we recognize that the workload is disproportionately unfair. And so when you look at some of the history, I know there was a change in certainly the quality improvement funding under the Gallant government was within 2 weeks' notice. The government cut the owner's pay by $12,000 a year. So this is primarily a female-dominated industry and dealt a serious blow which caused several centres to close, and it created uncertainty in the industry. So you talk about pay equity on the one hand while dealing a severe blow to an industry that employs thousands of women in this province, causing several centres to close. We all remember the protests on the lawn of the legislature. So we can talk about this, or we can actually find a way through this problem and give people a chance to get out in the workplace and do what they want to do, while at the same time look after their family. There's an opportunity here when we talk about it in relation to affordable childcare being a barrier. PC parties introduced a quality improvement funding to improve the wages of daycare workers, that make the industry more attractive, make it a career option, and improve the quality of care for families. In the last several years, we've seen a decline of women participating in the workforce. We've also looked at changes to make in the legislative process so that it makes it a more work-friendly environment for women candidates and women MLAs. We can provide a clear opportunity for women to get involved in the workforce.
Okay, and lastly, Mr. Guérin.
I saw my mother obviously take care of us when we were young, living in Moncton. She was working at the Burger King at the time. My father was working at the co-op in Buktush, so she was the one that was taking care of us. We then moved into Shediac Bridge, where I watched my mother at the age of 11, 12 years old take care of my grandparents. She became a full-time informal caregiver, so I know some of the challenges that many families are facing. That's why we introduced the informal caregiver benefit. This gives a benefit, an economic benefit, financial support to informal caregivers of seniors and people living with a disability. We, again, understand challenges when it comes to childcare, so that's why we're increasing the number of spaces, investing in the quality of childcare, and making it more affordable through free childcare and the middle-class support that we have offered. We have increased wages for the human services sector employees. We have raised wages for autism workers, for childcare educators. We announced today that we're going to continue to invest and increase salaries for home support workers. We've enhanced the senior home. We will enhance the senior homes renovations tax credit to allow seniors to stay in their homes even longer. We will invest in nursing homes. The Auditor General herself and many others say that we're going to need more nursing home and memory care beds. It's a good investment for the quality of life for those that need that type of care and for our hospitals so that we can get people that don't have to be there anymore and that's not the type of care that they need and deserve into the right type of care. And we're going to strengthen parental leave for teachers, nurses, and other civil servants to ensure that they have that support, and hopefully more men will be able to take parental leave as well, which would be great for everyone. And we'll enhance the family law case management model, which helps with marital and child custody matters to be more expeditious and less costly.
Okay, that was right on time. Because your comfort is important, we're going to take a quick 20-second so we can pour water into our glasses, okay? Just a quick refill, because I notice nobody wants to do it while people are talking, so we'll just do that.
There, David, let me put them here.
Thank you.
Oh, Marcia.
I am told that we are 8 minutes behind. Are we okay with that? Apparently is the question.
Where should we go?
Okay, so now we start our dialogue discussion, 5 minutes. Remember, the red is just a signal to try to keep it short. Actually, Ms. McKenzie had already signaled she wanted to speak. And then Mr. Guillaume? Mr. Kuhn? Okay.
Sorry, what are we speaking on?
So this is our discussion. So this is the opportunity to talk more about accessing and providing care.
I thought I
yes,
could.
everybody went around for 3 minutes, and then we're
I
just
was
at
no
our 5
longer
minute
allowed
discussion.
to speak. I've changed the channel. Yes, I think what is really important is the way we deliver health care. I always think of it as in a pyramid, and at the bottom is community-based care, preventative care, and making sure that once people get sick, they don't get more sick and end up in the higher levels of care. Because once someone leaves their home, we know that it takes much longer for them to return. And that's why the extramural program is so important, and returning it under the public sphere is important. But also home care and pharmacare are helpful to make sure that people don't end up in the hospital and in nursing homes.
Thank you. Mr. Guillaume?
We unveiled our plan to invest to ensure that people are able to stay in their homes as long as possible and live independently as long as possible today. That will be the priority. But there is no doubt that with an aging population, we need to ensure that we're investing in the infrastructure we're going to need. We need to, of course, do everything we can to have young people stay here and come back here so we can curb the aging population. But we need to also ensure we give seniors the best quality of care that they need and deserve. That's why over 5 years we would create 1,000 new nursing home and memory care beds, and we would increase the hours of care as well.
Mr. Kuhn?
So it's important not to just check boxes. Mr. Gallant ran through a long list of things, and when you start to drill down into them, many of them don't provide actual benefits to the degree that they're required to provide real help to women. On nursing homes, one of the things I'm quite concerned about is the move towards corporatizing nursing homes, and that's where new nursing homes seem to be going, away from the community-based nonprofit model where you have a community board with the interests of the community and the members at heart, and an army of volunteers from the community who volunteer their time in the nursing homes to help make for a high quality of life for the people living or the residents. We need to not get away from that. We need to go back to that and improve on that.
Thank you. Mr. Higgs?
You know, I had early on in the mandate when I got elected in 2010, I spent an afternoon at one of the nursing homes in, as Pam says, and the CEO there took me to meet with several of the residents. There were about 20 of them there. There are many in the building, but there were about 20 I met with. And after about 2 hours, we were walking back to the CEO's office, and she said, "How many of those people that you met do you think should be here?" And I said, "None of them." And she said, "You're absolutely right." My mom is 97, and she's living in her own home, and I'm very thankful for that. And my brother's there with her, and we have a nurse coming in 3 times a week. But she's 97 because she's living in her own home. And so the goal of providing health care where you need it, and we can go through a number of stories that what I think says it all, is that in the construction of nursing homes that Mr. Gallant refers to, the Nursing Home Association didn't provide any oversight or consultation to what's needed for our seniors in our province. I find that shocking.
Okay, thank you. Nobody signaled? Mr. Austin, did you want to?
Yeah, well, yes? I guess the one part I would like to add while we're on the topic of nursing homes is the idea that we're constantly, as a province, moving towards privatization of all of these things that government should be providing. And I was campaigning in Plaster Rock, and I went to a nursing home up there, which is a non-profit nursing home. And when you have non-profit status, you get volunteers, you get local groups. They all come in and contribute to the wellness of that nursing home. It is a top-notch facility. And when you privatize, it's all about the money and less about the community. So I think we need to get away from privatization of nursing homes and focus more on letting the public sector look after that.
Mr. Gallant?
I just want to reinforce, we believe that we're going to need more nursing home and memory care beds in this province, and that's why we'll invest to create 1,000 more over 5 years. The Auditor General thinks we're going to need more as well, by the way, and many other experts have pointed to this. But of course, we need to invest heavily and significantly and strategically in home care. And in fact, the plan that we put in place would have us estimate that we're going to be able to curb the demand by about 20 to 30% in terms of nursing homes that people would normally want with an aging population because of those investments, but we're still going to need nursing home and memory care beds.
Okay, we have Ms. McKenzie and then Mr. Higgs, and then I think, are we out of time? Okay, so Ms. McKenzie.
One of the key problems with the nursing home model that Mr. Gallant is putting forward is that it's based on a P3 model, and it takes people out of their own community. And so when you look at recovery times, when you look at how well people do, they do well in their own home, and then they do well when they recover inside their own community in some of these not-for-profit type nursing home arrangements. They're really wonderful places. I've seen some very happy residents there, and you don't want to put people in large Xanax buildings that are far away from where they're comfortable and able to heal.
The Auditor General had put forward the challenge that is facing New Brunswick, but the Nursing Home Association actually is in the business. They actually look at this, and so there's no part of the plan that Brian Gallant refers to is supported by the Nursing Home Association. Now, I want to give an example of where do you find money in the system to help provide better home care and health care. If you look at the Miramichi Nursing Home, so it's a 240-bed facility. There were 2 existing nursing homes there that said that they can provide the same level of beds, because I think it only increases the total number about by 40. The same number of beds, 60 million less. Now, how far would that go to building more, to having better home care salaries and to delivering better services to the people where they need it?
Okay. We are out of time, so apologies, but we must move on to the next topic. So I'm sure you will have opportunities to share more thoughts and weave it into it.
Nous allons maintenant en français. Nous allons parler de l'enjeu de sécurité et violence. Okay. Donc, parmi les femmes qui ont identifié la sécurité et la violence comme constituant un enjeu principal, elles ont exprimé des préoccupations. Donc, d'ordre général au sujet de la violence sexuelle, de la violence entre partenaires intimes et de la violence en milieu de travail. Voici ce que les femmes nous ont partagé concernant l'incidence de cet enjeu prioritaire sur leur vie. Première, j'ai été agressée et harcelée sexuellement à de nombreuses reprises. Chaque fois, la plupart des gens me disaient que c'était ma faute ou que la personne n'avait pas l'intention de me faire mal. Deuxième femme. On ne devrait pas avoir à attendre que le harcèlement obsessionnel ou toute autre forme de harcèlement s'aggrave pour que quelque chose soit fait. Les mesures de responsabilisation et de prévention doivent être prises plus tôt. Troisième femme. Une personne qui craint pour sa propre sécurité et sa santé mentale ne peut prospérer ou aider leur propre famille et communauté à prospérer. La violence et l'abus nous font tous souffrir.
Quatrième, le harcèlement sexuel en milieu de travail affecte la majorité des femmes que je connais. C'est une culture au Nouveau-Brunswick qui doit changer. Dernière, je travaille dans un milieu à prédominance masculine. Pendant 15 ans et certains jours, je me sens encore comme si je suis considérée comme un morceau de viande. Veuillez discuter de vos engagements et de votre vision portant sur la sécurité et la violence en tant qu'enjeu prioritaire qui affecte la vie des femmes et l'égalité au Nouveau-Brunswick. Nous commençons cette fois avec M. Austin.
Merci. I guess I still struggle to wrap my head around the fact that in 2018 we still deal with these things. But it is a reality. I understand that. I can tell you that as a leader of a political party, we would look at, the issues. We would certainly listen to people that face these issues and find ways that government can do better, whether it's through legislation, change in legislation, whether it's enforcing current legislation, whatever needs to be done. Because at the end of the day, this is about making sure women are treated as equals in the workforce, that they are not harassed sexually or otherwise, and certainly that domestic violence is taken care of and that it's prosecuted properly and that people can come forward when these issues happen. So again, our position is to stand up for women on these issues in any way possible and to look at legislation, either enforcing current legislation or adopting new legislation if necessary to create more equality and safety for women in the workplace and domestically.
Thank you, Mr. Austin. Mr. Kuhn.
Merci, Nadine. La culture du Nouveau-Brunswick doit changer tout à fait. Le taux de violence contre les femmes du Nouveau-Brunswick demeure élevé et le problème est même pire pour les femmes autochtones et les immigrants qui font face aussi au racisme et la discrimination. Nouveau-Brunswick a le taux le plus élevé en Atlantique de violence domestique reportée par la police. C'est incroyable pour nous. C'est la raison que la culture du Nouveau-Brunswick doit changer. Le gouvernement vert lancera une stratégie de sensibilisation avec un mandat de créer un environnement social dans lequel la violence des hommes sera universellement non acceptable. Chaque homme doit arriver à la conclusion que la violence contre les femmes est toujours inacceptable et sera réprimandée. Les lois maintenant actuelles concernant les congés de violence conjugale ne prennent pas en considération les violences sexistes qui se produisent en dehors des relations domestiques. Donc, pour nous, le Vert s'engage à expandre les lois actuelles afin d'inclure toute forme de violence. De plus, nous engageons à fournir un meilleur soutien de la prévention sur les campus, dont de l'information sur le consentement. Merci beaucoup.
Merci. Monsieur Higgs.
This should be a topic that would kind of bridge all politics and be non-political in every way, shape, or form. 41% of sexual violence victims in New Brunswick are students. In the legislative session over the last year, we brought forward a bill that was brought to us by the Student Alliance. And it was a bill that brought forward a process in post-secondary institutions in order to have quick response to victims in need. So it wasn't just, yes, we have a policy, it was, here are the steps that you follow. Because it's quick action that makes people feel confident that they can come forward and they can get a response and they'll be listened. We brought that forward, essentially word for word, from the Student Alliance. Here's what they recommended that the universities and community colleges would adopt in order to have a quick response and a system in place to ensure that results were achieved. The bill was brought forward. There was lots of debate and discussion. But at the end of the day, because it was an opposition bill, it was voted down by the government. Now you have to ask yourself, talk is cheap. It wasn't a bill we invented. It was a bill put forward by the Student Alliance because they were concerned about their students in their universities and their colleges. But because of politics and not accepting any opposition bills, it got lost.
Monsieur Galland?
M. Hicks dit qu'il ne veut pas politiser ce sujet qui est très important et tout ce qu'il fait, il prend son temps à me critiquer. C'est malheureux parce que c'est très sérieux ceci, la violence fondée sur le genre, que ce soit la violence sexuelle entre partenaires intimes, que ce soit familial, il faut travailler ensemble pour l'arrêter. Je peux vous dire que nous comprenons que c'est un problème pour tout le monde, parce que ça fait mal à nos familles, ça fait mal à nos enfants, et tout le monde a besoin de faire partie de la solution aussi. Et évidemment, la plupart du temps, c'est les hommes qui sont les agresseurs. C'est en raison de ça que nous avons fait l'engagement d'investir 1,4 million de dollars sur 2 ans dans le cadre sur la violence sexuelle pour la recherche, le développement, la sensibilisation, la prévention, l'intervention, perfectionnement pour les professionnels et la formation. Et bien sûr, nous voulons faire davantage sur les campus. Le projet de loi, c'était une motion qui est présentée. Le département de l'éducation postsecondaire nous a dit que ce n'était pas la meilleure façon de procéder. Nous travaillons avec les leaders sur les campus universitaires et collégiaux pour s'assurer que nous allons faire davantage pour leur appuyer dans leurs efforts à arrêter la violence basée sur le genre. The Intimate Partner Violence Intervention Act that we passed as well gives civil remedies to women and to protect themselves and their children in very difficult situations. We have also made amendments to have paid leave for survivors of domestic, sexual, and intimate partner violence. We have increased transition houses funding by 11%, and we have a commitment to increase funding for them by another 5% as a re-elected Liberal government, and we fully support the Missing and Murdered Indigenous Women's and Girls Inquiry, and we'll do everything we can to work with the federal government and our other partners to ensure that inquiry will be a success.
Merci. Et finalement, Madame McKenzie.
Thank you. Yes, we can do more studies, but there's a lot of things that we can do right away. We can hire more women into positions of authority and in law enforcement. We can make sure that when women report that they're being harassed or have experienced violence, that they're taken seriously. It's always important to listen to the victim and to trust the victim up until the point that it becomes no, you're not able to do that. It's very important to give the victim the rights and the ability to report in a confidential way and to have their concerns taken seriously and addressed. I think that, by being a woman leader and by having over 50% candidates, we already, can see the nature of the political debate start to change. There's been, in the question on child poverty, there was a back and forth between the parties of the two traditional parties about a completely off-topic discussion. That's a very masculine way of running politics. The murdered and missing women, Aboriginal women, is shameful that has not been addressed to date. There are ways to make sure that we can get to the bottom of that. There's really good things that we could be doing, and we need to start on that. We need to require that all post-secondary education facilities have a harassment and violence policy in place so that when these issues come forward, they're dealt with in a way that's respectful of the victim and gets to the bottom of the issue in a respectful way and in a way that is good for the victim. And I also want to say very quickly, since the men are allowed to go over their time, that
everybody. I'm just signaling 5 seconds.
that gay-straight alliances and that, respecting gender minorities, those go a long way. The fourth R, teaching young children, teaching adolescents, and teaching teenagers how to be respectful of other, what a good relationship means. That is an evidence-based, fact-driven type of policy that we could put in place and institute in our schools to help address these kinds of issues. Thank you for your indulgence.
Okay, I don't know how to start policing this.
I certainly won't protest.
OK. Alors, ceci, donc je retourne en français. Je laisse le temps pour les écouteurs. Ceci, c'est un sujet très important. Donc, et personnellement, moi, ça me touche beaucoup. Donc, avant de commencer notre discussion, on prend un moment pour absorber, on se rappelle des histoires que nous avons entendues. Je vous ramène à votre opportunité de signaler qu'est-ce qui est votre engagement et votre vision portant sur ces enjeux qui ont été mentionnés. Alors, personne ne m'a signalé. Monsieur Galland, allez-y.
Je veux simplement dire que nous étions fiers d'aider les maisons de transition qui aident les femmes et les enfants et essayer de s'en sortir de ces situations horribles de violence. Mais je veux toujours souligner que c'est important de pas seulement investir pour appuyer celles qui sont en train de passer à travers ces sortes de violences. Il faut investir pour éliminer toutes ces sortes de violences que nous voyons basées sur le genre. Alors, le 1,4 million, nous espérons, va être capable de nous aider à faire justement ça.
Merci. Monsieur Kuhn.
En réalité, il existe un défi dans notre culture au Nouveau-Brunswick. C'est raison qu'il est très important de lancer un programme de sensibilisation pour les hommes au Nouveau-Brunswick. Ce n'est pas acceptable, mais dans des coins de province, dans les coins de la culture des hommes au Nouveau-Brunswick, l'idée, c'est acceptable les violences contre les femmes. Mais c'est un problème, un défi culturel. Donc, c'est la raison que je disais, c'est très important de lancer une stratégie de sensibilisation.
Merci.
Simplement ajouter que je suis d'accord et ça fera partie du cadre sur la violence sexuelle. Donc, nous allons investir la sensibilisation et aussi la recherche et le développement et bien sûr l'intervention. Et on veut investir dans la formation des professionnels qui sont dans le domaine aussi. Et je suis fier de dire que nous avons développé ce cadre avec l'aide des intervenantes dans le secteur. Le centre d'agression sexuelle de Fredericton nous a aidé énormément et je le remercie.
Alors, nous avons M. Hicks et après Mme McKenzie.
I just think we need to have action on issues and make things move forward. My oldest daughter is living in Bangkok, and she's worked for NGOs around the world now for ever since she got out of university. And she is bringing awareness for women's issues, child exploitation, currently now in Asia. But it's been a mission of hers now since university. And when I think of her in those countries, and I think of how fortunate we are here, but yet unable to address some of these key issues, it is a concern about why in Canada aren't we able to respond quicker.
Okay. Ms. McKenzie?
I think it is really important that we build the capacity in the system to recognize and value and make sure that we have the types of systems that respect victims when they come forward. I know many victims do not come forward when they are harassed and when they are harmed by a perpetrator because the system is not friendly towards victims and you have to have a process in place, a policy in place for addressing those types of issues in a way that is respectful of the needs for confidentiality sometimes for the victim. And so we need to lead in the legislature to make sure that, you're not going to be able to cut me off now. We need to lead in the legislature to make sure that we do it in a way that that respects victims' rights. And I don't think that we do that now.
Thank you.
Yeah, I would just say, when I talk about a sense of urgency in the system, so New Brunswick sits in the middle of provinces in the rates of domestic violences, but we are high in the rates of sexual violence. The rates are highest for Aboriginal and disabled women. Every 6 days, a woman in Canada is killed by her intimate partner. This has a profound effect on children. Children who witness violence in their home have twice the rates of psychiatric disorders as children from nonviolent homes. There's a sense of urgency in New Brunswick. There's a sense of urgency in Canada. And unfortunately, we can't put priorities and just make things happen.
Okay, merci. Ils écoutent. Vous voyez, ils écoutent. Monsieur Kuhn?
Thank you. I mentioned about the sort of double impact on Indigenous women and immigrants, and it struck me some time ago when a member of St. Mary's First Nation mentioned that she felt unsafe crossing the river and being out and around during the day in Fredericton, and that really struck me and it stayed with me. So there is something fundamental in our culture that we have got to address. We have got to address, and I don't know at this point how to get at that, but we've got to get at it, and some kind of broad, comprehensive awareness campaign has got to be launched that's going to contribute to making a difference.
Merci. Ça va? OK. Alors, nous allons poursuivre et compléter. Nous allons faire la conclusion avec notre dernier enjeu, l'inégalité et la discrimination. Lorsqu'il leur fut demandé si elles avaient vécu du sexisme ou de la discrimination au cours des 12 derniers mois, 67%, et ça c'est plus que 2/3, 67% des participants à l'initiative Résonance ont répondu à la question par l'affirmative. Voici ce que les femmes nous ont partagé concernant l'incidence de cet enjeu prioritaire sur leur vie. Première femme, chaque jour est précaire pour quelqu'un comme moi, même en travaillant dans un milieu professionnel relativement privilégié, je me demande quand va survenir la prochaine insulte, le prochain contact physique non désiré ou le prochain commentaire sexiste. Deuxième, je suis une femme autochtone. C'est réellement ma vie au quotidien. Et vous pouvez penser que j'exagère. C'est plate parce que cela reflète le sexisme en soi. Je ne peux pas énumérer toutes les instances de sexisme et racisme de merde auxquelles j'ai été confrontée. Et le pire dans tout ça, c'est que dans probablement 80% des cas, les gens qui sont sexistes ou racistes n'ont pas l'intention de l'être. C'est simplement dû au fait que ces attitudes sont profondément enracinées et nous sommes tous si ignorants. Troisième femme, dans le milieu de travail, ce n'est rien de majeur ou d'évident non plus, ce qui, selon moi, est encore plus frustrant. C'est généralement comme si personne n'écoute ce que j'ai à dire, ou quand ils le font, mes idées sont rejetées et je me fais expliquer pourquoi elles sont mauvaises. Le pire, c'est que quand quelqu'un demande pour des idées et que j'en présente une, personne ne la valide et 2 minutes plus tard, un gars va dire exactement la même chose et tout d'un coup, il est un héros. Et dernièrement, les gens me demandent des questions ignorantes concernant ce qui me rend qualifiée pour mon emploi parce que je ne suis pas canadienne ou ils sont condescendants envers moi et ils assument que mon anglais n'est pas suffisamment bon pour que je les comprenne. Mes patrons me demandent si je détiens les compétences pour exécuter une tâche que j'ai accomplie à de nombreuses reprises auparavant. Je suis constamment sous-estimée en raison de la combinaison de ma race, de mon âge et de mon genre. Pouvez-vous maintenant discuter de vos engagements et de votre vision dans le but de remédier aux inégalités et à la discrimination en tant qu'enjeux prioritaires qui ont une incidence sur la vie des femmes et envers l'atteinte de l'égalité au Nouveau-Brunswick? Nous commençons avec M. Kuhn.
Merci beaucoup. C'est une grande question, une question très importante pour confronter l'inégalité et la discrimination ici au Nouveau-Brunswick. Un gouvernement vert va premièrement modifier la loi sur l'équité salariale pour inclure les lieux de travail du secteur privé. C'est important. Nous élargirons la portée et le budget des services d'aide juridique pour qu'ils soient comparables aux services offerts en Nouvelle-Écosse. Our legal aid system is miserably underfunded and the scope of it is so small that women find it very difficult to find the financial means to use the courts when they need to. Nous augmenterons les salaires des travailleuses et travailleurs à domicile afin de fournir un salaire vivable. Nous introduirons un revenu de base garanti. Dans un projet pilote du Manitoba, il y avait des succès où les femmes et les jeunes ont pu échapper à la pauvreté. Très impressionnant. Et nous prendrons en considération desquelles seront publiées les recommandations de l'enquête nationale sur les femmes et les filles autochtones disparues et assassinées. Those are coming soon. The recommendations of the Commission on Inquiry into Missing and Murdered Women and Children, and that's something we would take very seriously and implement in this province.
Mr. Higgs?
We obviously need better education, and I don't pretend to have all the answers. We need to turn to women to help us to address many of the points we discussed tonight and the issues that are important. And that's why the Women's Council is so important to me, to be a guide to help us set priorities and help us to get real results with things that are needed. Movements like the Me Too are helping to educate all of us. We need to take it to the next level and better protect women. Everyone deserves a safe and respectful workplace. And to that point, I would like to say that I am so proud of the people that I worked with over my career and every day today. And it's I would ask anyone to talk with individuals, women leaders that I've spoken to, worked with, have been a colleague of mine, because I think the greatest respect is what you do every day in your interactions. But anything less, as I say, or moving forward is unacceptable, and we had co-introduced with the Liberal MMA a motion in the legislature where politics was set aside, and it was harassment rules for political employees. And it was to ensure that MLAs take the necessary education on harassment and to be sure that things actually change. That motion did get passed. And this is an example where politics was put aside and we move forward on action that was important to employees. So I think we're all learning. We all have an opportunity to be better, and we need help in terms of setting what better means and then what a result looks like. So we're sure we achieve success.
Merci. Monsieur Galland?
I certainly wanted to come here and talk about our plans to advance women's equality, and I wasn't going to raise this, but I can't sit here next to Blaine Higgs when he says the Women's Council is important to him. He cut the funding of the Advisory Council on Women. He killed the Advisory Council. We reinstated the funding. We doubled the funding. We made it independent. We worked with you to create the Women's Council, and we are going to increase representation within our government by creating a Department of Women's Equality as well. Créer des opportunités pour tout le monde et créer une économie plus équitable pour tout le monde est au cœur de notre plateforme comme Parti libéral. C'est en raison de ça que nous voulons assurer que nous allons commencer avec le leadership à l'intérieur de toutes les sphères pour assurer qu'une perspective féminine va être là. En termes de notre parti politique, 40% de nos candidats sont des candidates. J'aurais aimé d'avoir 50%, mais c'est le chiffre le plus élevé, c'est le pourcentage le plus élevé que nous avons jamais vu comme parti politique, alors je suis fier de ça. Nous avons aussi encouragé plus de candidates en assurant que les partis politiques qui présentent plus de femmes auraient plus de subventions par la suite pour leur vote. De plus, nous avons nommé la première femme comme ministre des Finances ici au Nouveau-Brunswick, donc je pense qu'elle fait du beau travail puis elle mérite le poste, mais je pense que c'est un symbole important aussi. Nous allons, un gouvernement libéral réélu, subventionner la formation pour des petites entreprises pour leur apprendre les bénéfices de l'équité et la diversité à l'intérieur de leur place de travail. Et lorsque ça vient à des nominations aux agences, commissions et conseils d'administration, lorsqu'on est arrivé au gouvernement, 30% des nominations étaient des femmes. C'est maintenant rendu à 50%. Et lorsque ça vient aux présidents, présidentes des conseils d'administration, nous avons nominé 55% qui étaient des femmes. De plus, nous allons continuer d'investir pour assurer une perspective féminine à l'intérieur du gouvernement avec notre analyse comparative selon leur genre. Ça va certainement nous aider à faire justement ça.
Madame McKenzie.
I'm getting a little bit angry. To say that we need to turn to women to help us. We need to share power with women. That's what's important. If we start to put women in positions of power, then the society will start to change. One example would be the debate we had last week. When I heard there was going to be 5 minutes of people, a free, open forum, my staff called twice, and I also expressed my concerns with that format before the debate. Because as a woman whose voice will, I'll never be able to shout down the voice of the men, that would not have been a favorable format for me to debate in. And so when we start to have more women leaders, when we start to have more women in positions of power and authority, we will start to see those things change. And so we need to move from a paternalistic, male-dominated political arena to one that includes women, that values women's issues. I, as the leader of the NDP, starting from the ground, was able to find greater than 51% women candidates. Some of them, that when they ask for leave to be able to, or ask for permission to be able to run as candidates, they're told that they can't have it. And so we have, our community colleges and some of our school boards saying that in order for you to run as a candidate, you must take a financial penalty. And we even had one of our candidates who lost her job because she ran for the NDP. And so we need to look at the structural changes to our society. We need to value a diverse group of candidates. Oh, sorry, I'm going on.
You'll have a chance to
Thank you.
add on. Et Monsieur Austin.
Yeah, I think it's important that this is a twofold approach. I think legislation is important, but I don't think legislation in and of itself can change these issues. I think it takes groups like this. I think it takes universities. I think it takes other organizations to help change society. That's just the way society changes over time. And again, what we have committed to is legislation that's currently in place. If it's not being properly enforced, then let's put some teeth to it and make sure that it is indeed enforced. On the other hand, if there's legislation that's missing, if there's a piece that's missing that can help with issues of harassment in the workplace, that can help with domestic violence, then again, we have to look at these missing pieces and put that legislation in place to make sure that women are protected, not just in the workforce, but domestically as well.
Alors, nous allons maintenant commencer notre dialogue sur cet enjeu d'inégalité et de discrimination. Alors, quelqu'un, M. Galland, vous voulez commencer?
Je veux juste dire que je suis d'accord avec Ms. McKenzie lorsqu'elle parle du fait qu'on a besoin plus de femmes dans des positions d'influence. C'est en raison de ça que nous avons l'équité des genres sur la Cour provinciale lorsque ça vient aux juges, une sphère importante de notre société. Et nous sommes la seule province au Canada qui a ceci. On était évidemment le premier gouvernement ici au Nouveau-Brunswick de l'avoir aussi. Et lorsqu'on a plus de femmes à l'intérieur des organisations, on va avoir plus de collaboration, respect et coopération.
Merci. Quelqu'un qui veut ajouter, M. Kuhn?
On a besoin d'avoir à changer notre culture. We have a big job of culture change here. Nothing's going to change. Legislation, can be supportive and all of that, but we've got to focus on changing the culture in this province. Mm-hmm. And that's where the Women's Council and NGOs and all kinds of folks with interests here, we need to put our heads together and come up with strategies that are long-term, that are comprehensive, and that we can relentlessly apply to change that culture. And that's, I think, a key point.
OK, nous avons M. Higgs avant et après Mme McKenzie.
So firstly, I think, what Brian Gallant talks about in the Women's Council, it changes back in when I was finance minister. I'd like to point out I was not premier. I was finance minister. Mr. Gallant was premier when he cut the quality improvement funding for home care workers. And he was premier when the bill on gender-based violence was voted down by his government. So he was in the perfect position to make it happen, but he didn't. He chose not to. So when we look at putting women in positions of power, it becomes as a case of what are the barriers? What are the barriers that say, I don't want to be part of that? And I think in politics, there's a lot of barriers, not only in how we manage the legislature, but in the quality of debates that we have.
Merci. Madame McKenzie, ensuite M. Galland.
I think once you put a woman in a position of power where she has influence over how things are run, it completely transforms an organization. And some of the things that Mr. Kuhn is talking about start to happen. we start to work more collaboratively, we start to respect each other, we start to listen to each other, we don't grandstand as much, and we get things done. We really make things happen once we have women in positions of power working together and have the respect so that men aren't taking credit for ideas that we put forward, and we can really transform an organization.
Merci. Monsieur Galland?
Je vais juste simplement ajouter sur la question des diversités. Je pense que les symboles, parfois, ça vaut beaucoup. Alors, je suis très fier du fait que je suis le premier et, bien sûr, le seul premier ministre dans l'histoire de notre province qui a marché dans des parades de la fierté pour appuyer la communauté LGBTQ+. Je pense que c'est important. Je pense que non seulement que ça démontre qu'on est là pour les appuyer, mais on est là pour apprendre d'eux aussi.
Je regarde les gens de temps. Est-ce que nous sommes OK? Nous avons terminé. OK. Est-ce qu'il y avait d'autres commentaires?
Well, one of the things in terms of...
Je ne sais pas qui a... Je vais demander à l'audience, qui a flashé en premier? On n'est pas sûr. Go ahead. OK. Alors, M. Kuhn, et on finit avec Mme McKenzie.
Merci beaucoup. Just one of the things that I think is important is thinking about women in politics and women in the Legislative Assembly, kind of what Ms. McKenzie was talking about. We need to ensure that the Legislative Assembly is set up in a way that meets the needs of women as well as men. And I guess I've suggested this before. For example, we should have childcare, commitment to childcare at the Legislative Assembly available so that women who might consider running into politics see that as a real possibility for them.
Madame McKenzie, en conclusion?
Actually, I lost my train of thought. I should have gone first.
It's okay. Opportunity in the conclusion. J'ai été avisée que nous sommes 10 minutes en arrière, donc encore par le respect du temps. Nous allons maintenant dans la conclusion. Nous offrons à nos chefs de parti de réduire leur conclusion, de passer de 3 minutes à 1 minute. C'est complètement volontaire, c'est juste parce qu'on est un peu en arrière du temps. Alors, les chefs se sont prononcés sur chacun des 5 enjeux prioritaires identifiés par résonance et nous allons maintenant procéder aux allocutions de clôture. Donc, comme j'ai dit, vous avez 3 minutes. Si vous voulez le réduire à 1 minute, c'est libre à vous. Donc, nous commençons avec M. Higgs. Conclusion, s'il vous plaît.
Thank you. I want to thank you for having me here tonight. Merci d'avoir accueilli ce soir. Les enjeux que nous avons d'écouter ce soir sont importants. Je veux vous dire que j'ai été ici ce soir pour vous écouter autant que parler. The issues we are discussing are very important. I want you to know that I was here to listen as much as I was here to talk. Whether it's pay equity, gender-based violence, or women's health, we can all agree these are discussions we need to have. All issues are women's issues. Every policy government puts out affects women. That's why it's important we hear your voices reflected in our policies. Any policy has to be a women and a man policy together. It's why it's important women are at the table and part of decision-making in the process. This debate is an important part of it. It starts a conversation that doesn't end tonight. We know when women do better, families do better. When families do better, communities do better. And that means a better New Brunswick for all of us. Thank you very much for having me here. Thank you for being part of this. Merci beaucoup pour votre attention.
Monsieur Galland.
Merci encore aux organisatrices. Merci encore à mes collègues pour avoir participé à cette belle discussion. Lorsque j'ai devenu premier ministre, j'ai été demandé lors d'une session avec la fonction publique la question suivante. Qu'est-ce que vous aimeriez de faire avec votre temps comme premier ministre? And my answer as to what I want to do as premier 4 years ago when I was sworn in was that I wanted to ensure that we improve education, and more specifically, I wanted to ensure that we give our children the best start in life. I wanted to ensure that we do everything we can to face the aging population challenges before us and also see some of the opportunities. And third, I wanted to advance women's equality. Lors des 4 dernières années, nous avons fait des investissements stratégiques, nous avons instauré des projets de loi, nous avons fait des efforts ensemble pour avancer l'égalité des femmes ici au Nouveau-Brunswick. Il n'y a aucun doute qu'il reste encore beaucoup de travail à faire, mais je vais vous dire que je suis très fier de ce qu'on a pu accomplir ensemble lors des 4 dernières années. Over the next 4 years, we want to continue to invest to better the lives of all families, and of course, to continue to invest to advance women's equality. We want to give free childcare, free tuition to families that need it the most. We want to help the middle class with the cost of tuition and childcare. We want to invest in education to improve our literacy skills, introduce coding in our schools, reintroduce trades in our schools, double investments in the Youth Employment Fund, help people that have internships in the spheres of education, healthcare, social work, sports and culture, be able to get paid for their internships, which predominantly those sectors are women. We want to invest to help with the cost and increase wages for families that are struggling to get ahead, whether it's raising the minimum wage to $14, freezing power rates for 4 years, imposing pay equity on large businesses. We want to do these things because we recognize that advancing women's equality is really about strengthening our families, strengthening our communities, and making a fairer economy for all New Brunswickers. Merci.
Merci. Madame Mackenzie.
That sounds really good, but two of the key promises that Mr. Gallant made in the last election were aimed towards women. One was pay equity in the private sector. One was improving nursing home ratios. I will also add that the way that home care workers are treated and indirectly run by the government is also not being done in a way that is beneficial to women. Our literacy scores have a long way to go. I was a leader in the engineering field. I had to claw my way to the top, and in the school board, and I experienced a lot of discrimination and a lot of harassment. Men do not hand over power readily, and I'm hyper aware now of discrimination as I see it in our society and throughout the systems. When I go and knock on doors, I am also very aware of how the system discriminates against women and against minorities. Our platform is very women-focused, and that wasn't intentional. It's simply because we have a lot of women sitting around the table helping us to form our policy. And several of our ideas have been adopted by the other parties, and I'm very pleased about that because it means that having a woman leader, even though I'm often the only one on stage, is changing the conversation. It's changing how the political discourse happens in this province. And that is a very good and wonderful thing, and that is what's going to help us transform ourselves into a province that respects women and values women and puts them in positions of power too.
Okay. Ms. Justin?
I just want to thank the organizers of this event for allowing me to be part of it and discussing these important issues. Again, we are learning as well about issues that women face today. We do have policies in our platform that I truly believe will help advance these causes in terms of the workplace and in other areas. But again, what I commit to as party leader of the People's Alliance is strengthening legislation that is there or furthering legislation, enacting new legislation to make things better if needed. So, again, we're open to discussion, and I applaud the Women's Council and the university and other groups that are continuing to work on these important issues. Thank you very much.
Merci. Et Monsieur Kuhn.
Merci beaucoup. Je veux dire merci au Conseil des femmes pour l'invitation d'assister au forum ce soir. And I appreciate all of you being here to attend, to listen to all of us over this period of time. If you believe in doing politics differently, to improve the lives of women and to pursue equality in New Brunswick, then it's vital to consider supporting a party, such as the Green Party, that actually practices a different kind of politics, one that is collaborative, one that is participatory, one that's focused on the common good and has a long-term view. We're not about checking off the boxes, but working with communities, working with NGOs, working with community organizations to actually solve problems. We don't have back rooms, although at our campaign headquarters there was a back room. and I was jokingly said, well, we've got our first back room. And one of the women running for us in one of the ridings near Fredericton seized the room, staked her flag, and said, this is my office for campaigning. So she has that. So we have a front room full of women in my campaign. My chief of staff was a woman. One of my 2 deputy leaders is a woman. Our provincial campaign manager is a woman. The chair of my re-election campaign is a woman. The executive director of our party is a woman. 49% of our candidates are women, from millennials to an octogenarian, 81 years old, young. Imagine for a moment how a party like this would translate into a government that we might form to work with all of you to address women's equality in the future in New Brunswick. I believe with every fiber of my being in justice and equality, and I believe that we must work together to achieve that. I'm also very proud that in New Brunswick and the Maritimes, the leaders of our environmental movement, because we need to think about the future as fair and just and sustainable as well. The leaders of our environmental movement in this region have been women, like Elizabeth May from Cape Breton, like Lois Corbett in Fredericton, like Janice Harvey from Grand Manan, and on and on. One can think of names throughout our region who've been leading on the movement towards sustainability, because when we think about the future our children face in the face of the climate crisis, it's extremely concerning about what kind of future we might leave them, and we need to take action now to ensure that they have a better chance with the future that we're staring down at this moment. So I want to thank you. Merci beaucoup, Oliwan. And I hope that on September 24th, you'll give strong consideration to supporting your Green candidates. Thank you.
Donc, je tiens à remercier chacun des chefs des partis d'avoir été parmi nous ce soir. Merci encore une fois aux personnes présentes dans l'auditoire, ainsi qu'à celles qui se sont jointes à nous à partir de la maison. Vous pouvez explorer les mots-clics Resonate NB et Résonance NB en ligne pour un récapitulatif du déroulement de l'événement et afin de poursuivre la conversation. Le présent vidéo sera aussi accessible sur les pages Facebook du Conseil et un enregistrement de celui-ci sera également affiché sur YouTube. Alors sur ce, bonne soirée. Merci. Thank you. Wolimon.
Thank you very much.